why I always say put horizontal attachments, big ones, the widest that can fit there. And I often tell you the number one thing, remove all optimized. Why have you got them? So what these authors looked at was clear attachment design, particularly for extrusion of maxillary lateral incisors, because it can be quite a difficult movement. And they did a multi-center, so they had a few orthodontists in this trial, single-blind randomized clinical trial. So we know extrusion is difficult. Now, what you see here, the case is one of my cases. This is a lady in her, I'd say, 60s. We know that the accuracy of extrusion of teeth is approximately how much? Accuracy is about 70%. Yes, very good. We know they're difficult movements to achieve, especially when they're small teeth. One of the biggest issues with lateral incisor is that they have a lower surface area compared to other teeth. So the aligner only has a very small surface to express its forces and contact. So pretty much almost always I tell you put attachments on lateral incisors. Okay, so what this study did, it looked at in a randomized control trial way, looked at comparing horizontal type of attachments to optimized attachments that Invisalign software triggers automatically. You know, if you don't tell Invisalign what to do, they're going to trigger optimized attachments, which are down below. You know, any of those optimized extrusion attachments. But unless you tell them, give me horizontal, they won't give you these. So what they looked at, and even in horizontals, there's three types. There's that conventional type, which is in the first photograph. Then you have the horizontal with bevel to the gingiva. So it's a gingival beveled horizontal attachment. Then you have horizontal attachment with bevel to the incisal. Again, no study has ever shown that the bevels are better than conventional. In fact, there is some indirect evidence that conventional, the solid rectangular shape is the best. And we'll talk about that. So they looked at the horizontals as a group, and they looked at optimized extrusion, and they only singled out maxillary lateral incisor extrusion. So they wanted to see which attachments better, right? So they collected data from 3 different orthodontic practices, which is great because you have 3 different operators, right? So it's quite generalizable. And they looked at that at least 0.3 millimeter of extrusion was planned. I mean, that's a very low amount of extrusion as a baseline criteria. And they just said, look, we're just going to compare the first set of aligners, and it should be between 20 to 25. So everyone has to be almost equal, right? Because the less complex cases get filtered out. Everyone should be almost adult. And they looked at those 4 attachment designs, but they actually grouped the horizontals together. And what's not clear to me in the paper, what optimized extrusion attachment was triggered by Invisalign? Was it the one on the right or one on the left? Wasn't clear to me. So anyhow, let's just group them together. Invisalign triggered an attachment when you told Invisalign, extrude my lateral incisor, and you gave no other instruction, they're going to trigger those tiny little optimized attachments. So they compared that. Now, always we want to look at, when you compare 3 or 4 different things, you always want to look at were the groups equal at the start. So when you look at that, there's 4 attachment groups: optimized, horizontal bevel to the gingiva, horizontal bevel to the incisal. When you look at the amount of planned extrusion movement for all 4 groups, it was very similar. It's not an incredible amount of extrusion though. 0.7, 0.9, 0.9, and we're not even like 1 millimeter. Okay, so to me, they don't need that much extrusion. They're not complex cases. The age is similar between the 4 groups. They're all approximately in their 30s. The number of trays were very similar because obviously if your extrusion movement is similar, your trays would be very similar. They had compliance, which was obviously self-reported. They said they wore 17 to 18 hours a day, approximately. So everything was quite similar except the gender balance, which, you know, often we have more females in treatment than male in our offices. So the conclusion, when they looked at all of that and they superimposed the 2 models of predicted versus planned extrusion, they found that all the 3 horizontal attachments on the top, they performed a lot better than the optimized down the bottom. Okay, so the top group performed a lot better, incredibly, significantly better. How much? Which is, we always say extrusions approximately 76% predictable. That's what they got. They got about 76% of the predicted amount of movement, and optimized didn't deliver as much. So there was a gap of about 12%, I think, 14%. So they're saying, well, basically any horizontal works. And when you look at the 3 horizontals, they couldn't find a difference. But to be honest, they only had very small number of patients per group. Okay. You're looking at like 18 number per group. So I don't think they had enough sample to look at what was better. And also, when you only have 0.9 millimeter extrusion plan, it's not even a full millimeter. It's quite a small movement. I guess any attachment horizontal would work. Okay. What I'm surprised is that optimized was almost 62%. I was expecting it 40 to 50%, much lower. Again, I think because these cases were simple at the start. So we all agree now that horizontal attachments are the best attachments for extrusion. Do we all agree? Thumbs up, hearts, emojis. Do we all agree? Yeah. Good, 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 good. We all agree. So horizontals, and this is a RCT, randomized controlled trial. Now, of course, this paper applies to Invisalign. However, similar principles should apply to other aligner systems. So we now know that. I'm just going to go. So basically, our 3 attachments here, the horizontals, they trump, okay? And we shouldn't really use optimized attachments for our extrusion, really. Anytime. What are optimized is the ones triggered by the system. They don't even have a conventional shape. They look weird, okay? They're optimized. But one thing they didn't address, which I love this paper for, and I have presented this paper to you guys earlier this year. I really do love this paper because it shows that attachment size matters. Clinically, I have found that when I'm doing my cases, I found the bigger the attachment, the bigger the handle I put, the better the result. So this is a study that looked at finite element method and analyzed teeth in vitro, not in vivo. But it's a really good study because it kind of shows us they varied the thickness, width, length of attachments, and looked at every aligner. So they moved the teeth mesily and modeled and found what is the best attachment size. In the end, what they're finding is the bigger the attachment, the more bigger, wider, thicker, longer it is, the more the force it produces. And the moment is every force has a rotational moment of the force, because no force goes directly through the center of resistance of the tooth. So it has a rotational element to it. So every force does rotate the tooth somewhat. The bigger the attachment, the less that rotation was. So the tooth moved more linearly, it moved more bodily. Hence, the big attachments were able to also have dissipation of the force all along the tooth surface. The direction of force was better. The desired movement was much more achievable in the right direction with the larger attachment size. So we know that from this study. So looking at those 2 studies, the RCT, which was a clinical trial, and this in vitro study that I just showed you, my recommendation is, and this also now combines a bit of my experience, is that the best attachment for lateral incisor extrusion is the horizontal conventional. The biggest size that you can get, the widest side you can get, and placed close to incisal third. Okay, so you kind of see a picture of it here. You see the 1, 2, and 2, 2, the upper lateral incisors. They're kind of showing, these are my favorite attachments. Now, this is an Invisalign case here. Let's look at this movie. This is the same case. This is one of my patients where we did the extrusion. This is the adult in her 60s. And we did some retraction of the upper incisor. So there's a bit of root movement, plus there's extrusion, and quite a lot of extrusion, okay? Quite a lot of retraction, extrusion. Now with that comes root movement and root torque as well. So you see my big attachments that I placed parallel to the incisal edges, close to the incisal edges, but not at the edge. So you're kind of at the junction of middle and incisal third. And I believe these are difficult movements. Okay, anyone who's done aligner treatments here, a few treatments, will know that lateral incisor extrusion is very difficult, particularly lateral incisor, because of the small surface area. So this is my case. We finished the case. You can see the treatment plan wasn't to change buccal occlusion. It was to maintain the midlines, level her teeth, maintain the overbite, maintain the overjet, and just get the 1 to 2 to extruded and some expansion. So you see the case is finished here, quite nicely leveled, quite nicely extruded. So not only it extruded, it also did root torque. What I'm trying to tell you is the randomized control trial, the clinical study showed horizontal conventional or bevel didn't matter. I believe horizontal conventional is going to be better. If they had a bigger sample size and if they actually had done more advanced extrusion beyond 2 millimeter extrusions, you would see, possibly they would see in their study that the horizontal conventional would have performed slightly better than the beveled. So, and that's because we know that from the in vitro study. Okay, the smaller the tooth, the harder the extrusion, the harder actually any movement. And that's why even lower lateral incisors, lower central incisors, very difficult, harder for rotation, because you just don't have enough surface area for the aligner surface, tooth surface contact to be able to express that force. So often we will use attachments on them.